We have got a doctor and an author with us today, touching on a topic that too many are familiar with. It is cancer. We've got Dr. Kerry Forrestal. He's an emergency room doctor and the author of Crushing Cancer, A Patient's Complete Guide to Managing a Cancer Diagnosis. And thanks for joining us today, Doctor.
Good morning. Thank you so much for having me.
Okay, so you picked a topic for your book that has really hit somebody one way or another, whether they have family members or themselves a cancer diagnosis. How did you get the idea and want to bring together this book?
Well, I'm an emergency room doctor by trade and training. So it's always struck people, they always ask the first question, why? Why does an ER doctor write a book on cancer? And there are three answers. I know our time is limited, so I'll keep them brief. So the first is that we diagnose a lot of it in the emergency department. People come in for various reasons. We take an x-ray or we do some blood work and there's a suspicion of cancer. And then we have to go to them with this news and say, oh, well, you may have this problem. And the second part is that we find so much, but then I can't do anything more about it. I have to send them on their way to the oncologist, hope that they do the follow-up. So I then wanted to do something that reached beyond the emergency department, and that was Crushing Cancer. This allows me to help patients outside of the emergency department. And the final thing is just very personal. Cancer runs very, very strongly in my family. My grandfather had metastatic bladder cancer in 1970. My grandmother had 2 bouts of uterine. My mother, 4 bouts of lung cancer. Father's skin, brother-in-law prostate, not that he's genetically related, but it's affected my family a very, very great deal. So 1.7 million people, 1.8 million people, actually, the new numbers, are going to get cancer this year alone, and next year, and next year, and next year. Fully 1/3 of all Americans are going to get this diagnosis in their lifetime.
Wow. So it's going to hit a lot of people. And this book, I feel like, is different. It's not like a personal story about getting through cancer. It's not like an elegant read on the beach. This is really packed with information that people need.
Yeah, it's a reference book. Somebody referred to it as it's what to expect when you're expecting for cancer care. So we do talk about the medical aspects of it. What are the tests, the treatments? What's the pathology treatment? What's the process that we go through for that you have to wait those weeks, those really nerve-wracking weeks. But then we also talk about your workplace protections. How do you protect yourself at your place of work when this happens to you? What are the legal protections that you have? And one of the big chapters here is the finance chapter. 3% of all cancer patients will go bankrupt. And 3% doesn't sound like a big number until you apply it to 2 million people. And then there's what they call financial toxicity, which you're left with tens of thousands of dollars. You don't go bankrupt, but you're paying this off for a very, very long time. So we try to teach you how to protect yourself financially. And it does have an impact on the outcome. If you can't afford to go to chemotherapy, if you can't afford the medications, you're not going to do as well. And we talk about the spiritual aspects of it, psychological aspects of it, the interpersonal relationships. How do you manage all the people who you have to deal with when you're dealing with this cancer diagnosis? And we do that, we say, from hour one, day one. From the moment you get that diagnosis, this is the playbook for how you manage this whole thing.
Mm-hmm. What kind of feedback have you gotten, maybe even from doctors, but from people who have used the book?
Well, for doctors, people who interact with me directly, the first is why did an ER guy write this book? And then they see what we've done and they go, oh, that's an integration. You basically, ER by default, we're integrators. We pull in all the different people that you need to affect somebody's care outside of cancer even. So for heart, stroke, trauma, we're the integrators. And that's what this is. They go, this is basically you pulled in 36 experts and put together the playbook for how to manage your cancer care. So there's that. And then as far as like the American Society for Clinical Oncologists, the big group of oncologists, they just reviewed it, the book, and gave it a very lovely review. They really said that this is an important addition to the patient cancer education. So it's been very, very well received. So, and looking forward to doing more of it. This is supposed to be the first in a series of books, some focusing, we hope to get to the point of focusing on specifically breast cancer, prostate, lung, colon, melanoma, so to give each patient something that's really specific to what their needs are, because they change.
Mm-hmm. I think also maybe the bottom line there's a message of hope. Yeah, maybe the ER doctor told you this, but you can get through it. Things have really changed.
Oh yeah, I gave you that whole laundry list of people in my family who had it, but only my grandfather in 1970, when we really didn't have a lot to offer, passed of the disease. Everybody else has survived. If I were to leave everybody with one message, it would be this: you do not fight alone. You have to understand there is an army of people at your back. There are, I think, 13,000 oncologists, 8,000 APPs, an army of researchers out there every day doing the work. There are 9,000 nurse navigators across the United States. Get to know, if you're listening to this and you have cancer, get to know your nurse navigator. They are the Sherpa guides for this whole thing. But you do not fight alone. And you have every reason to hope. We're in a new age of cancer care in immunotherapy. They're doing incredible, almost magical things. So you have every reason to be hopeful. You have every reason to fight this fight because we're right with you.
And one of the tools might be helpful is this Crushing Cancer, a Patient's Complete Guide to Managing a Cancer Diagnosis. Again, you can get it online, right?
Absolutely. It's at Amazon and Barnes & Noble, and then there are a whole slew of electronic readers out there. Yeah. So, but yeah, this book was written based on the feedback from what patients need. Right. So this is not me telling you, this is you asking the question, the cancer patient asking the question, and me going and finding the information from the smartest people I could find. All
right, all in one book, easy for you to have the information. Doctor, thank you very much for joining us today.
Thank you so much for having me. I appreciate your time.
Don't go away. Noon Edition continues in a moment.